Good afternoon. Welcome to a Facebook Live session presented by Apollo Hospitals. This is Dr. Srinidhi Chidambaram, and I hope you've all been keeping well and safe. We at Apollo Hospitals always take great pride in bringing you authentic and relevant information on common diseases and conditions, the latest technologies and innovations, and path-breaking treatments so that you can live a life of good health and well-being. The much-awaited monsoons are here in India. As the skies turn grey and we smell the fragrance of raindrops and wet soil, the air becomes cool, bringing us relief from the scorching summer just gone by. The earth turns lush and green, and we are overcome by the desire to splash about, eat hot street food, drink endless cups of chai, and dance in the rain. But in order to enjoy the monsoons without falling sick and feeling miserable, it's important to know that monsoon is a time when certain diseases can spread. It's important to know what these diseases are, how they are transmitted, and how best to prevent them. During the monsoon season, the risk of infection is higher than any other season because of the high moisture in the air, making it ideal for microorganisms to proliferate and thrive. Infections can be from various modes like water, air, or mosquito borne, as we shall see. Let's look at all the risks that we are exposed to in this season and how we can be absolutely safe. To guide us on this topic and talk to us about common diseases during the monsoons and how to prevent them, I am very happy to welcome Dr. Rajib Paul. Dr. Rajib Paul, MD in Internal Medicine, has been working in critical care for the last 16 years. He's currently associated with Apollo Hospitals, Jubilee Hills, Hyderabad, where he is a senior consultant physician and intensivist. He's been the past honorary secretary of the ISCCM Hyderabad, a teacher for IDCCM, FCCM, and FNB critical care courses. He's also an examiner of the Royal College of Emergency Medicine, UK. He's conducted 4 critical care conferences in 2009, 10, 12, and 14, each with more than 150 participants from all over Hyderabad, conducted ventilator workshop, nutrition workshop for the dietitians of Hyderabad, numerous CMEs and panel discussions, and is also the coordinator of NIVCON, the first dedicated NIV workshop. He's also had avid publisher, and he's had many case studies and research studies that has been published in many journals and is also involved in several phase 2 trials. Welcome, Dr. Paul, to this Facebook session. Thank you so much for joining us here today. So let's begin with asking you, what are the common monsoon-related infectious diseases?
Thank you, Dr. Srinidhi. It's a privilege to be part of this program. I'm trying to understand the concept of monsoon and illness. Monsoon being a season which many people look up to, especially with the summers in our country, sometimes running of temperatures of 45 plus. So we always look for the monsoon to cool it down. But along with this, we do get some of the other infections which probably the summer season, they are absent or very less prevalent. They do start picking up in this monsoon season. And most, as you already told in your initial talk about the increased chances of diseases in monsoon season, mainly because of moisture content. The increased moisture content basically making bacteria, viruses, and other organisms to thrive better. So similarly, there are other infections which do start getting more prevalent in the monsoon seasons. And India being a tropical country, we know mosquitoes borne diseases are one of the most common diseases that start to get proliferated in this time. Mosquitoes, as you know, typically most active season is the monsoon season for the mosquitoes. The breeding of mosquitoes starts to happen when lots of puddles of water and everything start accumulating. And diseases like malaria, like dengue fever, chikungunya, all are mosquito-borne diseases, they start to proliferate. Also, waterborne diseases start to get more prevalent during this time. Waterborne diseases like typhoid fever. Most of you have heard about typhoid fever. Cholera, though luckily cholera is not so common in the country right now, but we have some periods when cholera becomes a big problem. There's a disease called leptospirosis, and then hepatitis A, or what leads to what you call as common jaundice. Other than that, common gastrointestinal infection, what you get as routine loose stools, diarrhea, vomitings, which very commonly creep up because of the water contamination. So cholera, jaundice, with gastrointestinal infections. Also, some airborne diseases like influenza and on the common cold also start to get prevalent during this time, mainly because of the increased moisture content and airways getting the virus staying in the airways more longer.
So, which age groups are, or is it like across all age groups? Who's most prone to get affected?
Um, Regarding the age groups, most of that it can affect any age group. As you see, the vector-borne diseases like what we talk of malaria, dengue,
Yeah.
they obviously will not follow any particular age pattern. A child who is not protected, sleeping, getting mosquito bites, exposed to chikungunya, dengue. Similarly, any person can get a contaminated water intake and develop hepatitis A or gastroenteritis or typhoid. So age groups may not be, but people who are going out are more active. Obviously, that's more chance they pick up infections. That's how it would be. But
Eat
age
out a
ones,
lot,
yeah,
this
it
is.
out a lot. So it's not age prevalence, but more of activity dependent, which will decide the disease.
Let's now go to each category of transmission and talk about some of those diseases in detail. So we'll first begin with the mosquito-borne diseases. So could you give us a kind of a brief overview on, especially on how to protect ourselves from malaria, dengue, and the other vector-borne diseases during this time, and uh, also which ones particularly are like dangerous and needs to be like you might need emergency care and so.
Yeah, Srinidhi, as the monsoon, as I told you, is the main season where mosquitoes thrive, and mosquitoes do bring in malaria and dengue, and also chikungunya in some parts of country. There's another virus called the West Nile virus, and but we don't get much to that over the disease. Uh, Most of the mosquitoes, the most common we get presently are the dengue patients. Malaria also is prevalent, little less in the city, come little more in the suburban areas and the rural areas. In the city, most of the time it is the dengue virus, which is carried by the mosquitoes, and there are different virus mosquitoes which like dengue is carried by Aedes mosquito. So mosquitoes, different types of mosquitoes carry different types of infections. So the most important thing is obviously it's impossible to escape a mosquito bite, but we can do some basic precautions like have if you are staying in an area where you are infested with mosquitoes, you should definitely use mosquito nets in the night. Malaria basically is most of the times the night biting mosquitoes which will transmit malaria. Dengue would be the evening ones and the afternoon ones. But this is basically a scientific way. But most of the time now we are seeing overlapping of even dengue virus mosquitoes could be prevalent in the evening and night also. So self protection is the most important. If you're going out to infested areas, you can use some. If you're try to wear full sleeve dresses so that you cover your body parts, especially in areas where more mosquitoes are prevalent. And if you are wearing short dresses, then try to use some mosquito repellent creams which can deter mosquito bites. Surrounding the community, yes, it's a part of everyone's important for everyone to see that the communities are clean, your surroundings are clean, they are regularly sprayed with mosquito repellents, and you don't let water stagnate in any places where mosquitoes can start breeding. So vector-borne diseases, the most important is control of the vector. And second is trying to get see that you don't get bitten by vector as much as by sleeping in mosquito nets and using some mosquito repellents in the night.
So, so what are the common symptoms of these conditions like malaria, dengue, and leptospirosis? I mean, are there like, I know that most of them have this high fever or shivering or body pain, or are there any characteristic symptoms?
Yes, in the malaria and dengue basically and chikungunya are the mosquito-borne diseases that we talk of. Leptospirosis is not mosquito-borne. It is directly through inoculation that I'll talk of later. The three diseases, malaria, dengue, and chikungunya, all present with fever as a primary symptom. So all of them will have fever. Malaria comes with fever with rigors. So you can say a patient who has a fever and develops a very bad chills, he requires 2 or 3 blankets. So bad is the chill, he will require 2 or 3 blankets. Is basically the classical description of malaria. Dengue basically means severe body pains. So a patient who comes with fever and has a very bad headache and also has severe muscle pains. So the body pains are mostly muscular, muscle pains, and may also have abdominal pains. This patient is probably a case of rigors or chills. Chills may be there in dengue, but rigors are generally not there in dengue. Rigor is an extreme form of chills when you require multiple blankets to keep you comfortable. While in dengue, you have severe headache, you have severe muscle pains, and also some patients abdominal pain. In chikungunya, it's classical. I think many people know chikungunya basically makes you bend over with the joints are involved. The fever with severe decapacitating joint pains. We have seen patients who even come not able to walk to the hospital. They come to emergency on stretchers and wheels. So severe is the joint pain. So fever, joint pains is typical of chikungunya. Fever, muscle pains, abdominal pains, and headache of dengue. Fever with rigors is typical of malaria. So these are the three things. A distinguishable pattern is mostly available.
And what should be the next course of action if somebody has these symptoms? So, what kind of do they need to come to the emergency, or do they need to just see a doctor, take some blood tests and treatments?
Uh, it all depends on the patient's underlying problems and also how many days you're having fever. Obviously, if you're having rigors, you can't manage this at home. It has to be the hospital where you require injections and other medications to get you better. Dengue, if you are basically having high fever for 2 days, you're not able to eat, you're vomiting, your headache is very bad, your pain abdomen is quite severe, you're feeling thirsty, you're feeling drowsy, absolutely this patient needs to come to the hospital. Simple fever, you can get a dengue test done at home. But if you have fever with feelings of dehydration, severe abdominal pain, just keeping on vomiting, not taking any food, you need to come to the hospital. Chikungunya is comparatively milder. Among these two diseases, malaria and dengue can kill if not treated. Chikungunya is generally a non-fatal disease, but it is a very bad disease. So most people are drawn to hospital because of severe pain, which they can't manage with simple tablets at home. So in chikungunya, it's a pain which brings the patient. Dengue, if you have signs of dehydration, you need to come to the hospital. If you have high fever and evidence of dehydration. In malaria, most of the time the patients will come because of the extreme rigors that they develop.
As far as dengue is concerned, who develops the dengue hemorrhagic complications?
Dengue hemorrhagic complications are more common in people who have previously been infected with dengue. So if you had somebody had a past infection with dengue, they are the ones who develop the severe dengue complication, but it is not a rule. It is a association. So people with the past history of dengue are more prone to developing the complicated or the severe dengue. But it could even happen in the first episode of dengue fever. It is basically the body's immune response. Similar in COVID, we have seen people first time getting COVID and getting complicated COVID. Some people are just mild. So similar like dengue, even a first infection can lead to complications. There's no subgroup of patients which can tell that this patient may not develop severe disease. But yes, people who are previously infected need to be more watchful.
So moving on to the waterborne diseases, which are also prevalent during the monsoon. So what are the measures by which, like how does it spread and how is it transmitted? So what does one do to prevent these diseases?
Waterborne diseases, I told you, the common waterborne diseases which we see are enteric fever, or medically we call it typhoid fever. You have a cholera, you have hepatitis A, you have simple gastroenteritis, and leptospirosis. Out of this, except leptospirosis, all are through ingestion of bad or contaminated water, or uncooked or raw food, or untreated food, or spoiled food. So you talk of hepatitis A, you talk of gastroenteritis. If you are eating some street roadside food which are not cooked properly, or raw food, or food which has been kept, or stale food, then the chance that you may develop these infections. Similar also with water. If the water of which you're drinking is not safe, then you may develop gastroenteritis and even hepatitis A, which may lead to jaundice. Even typhoid also is mostly through waterborne. The leptospira is a little different from this. Leptospirosis is not so common in the urban context, but now that urban and rural, semi-urban, all getting mixed up as the cities are expanding more and more. So we are encroaching into the semi-urban and suburban and the rural areas. So leptospirosis we do seeing more in cases now. Basically, it's through rats' urine. I mean, the rats' urine contain the leptospirosis organisms, and if the water is contaminated, like especially people who are mostly agriculturists, or the farmers, or working in the fields, if they're walking with barefoot and there is a cut in the foot, they have some cuts in the foot, they're walking with barefoot, and the water there is contaminated with the leptospira organisms secreted from the rats. This organism then will enter through this contaminated from the cut wound, through the contaminated water, and then cause bloodstream infection. This is a different way. The others are all through ingestion of bad water of food.
So what can one do to, so is it that, there are certain precautions in, is it like, better not to eat raw food or uncooked food outside, or boil the water extra? What are the preventive measures for foodborne
See,
monsoon?
basically, the rule of thumb is that always try to eat, if you're eating outside, see that it's well cooked food and should be hot when you're served on the table. Even ice creams are known to, if ice creams are known to cause typhoid fever. So if you're eating from some roadside ice creams, you always run the risk of developing this type of infections. Cooked food outside should be well cooked and should be hot table, served on your table with hot temperature. That is some precautions. Uh, Eating obviously bottled mineral water. Bottled water is the safest way when we go out. Not drinking tap water from anywhere. We never know the purity of it. These two are the main precautions which I would say, and obviously the people eat cut fruits and all this on the roadside, so which are completely should be severely not promoted at all. I mean, discouraged to do eat cut fruits from the roadside vendors. Yes.
So now coming to the airborne diseases. So starting from the common cold to influenza to what else can spread from the as airborne droplet or airborne infections during this time?
Influenza, basically we get the common cold and the influenza also more common during this time, and um, it's basically as I told you, the moisture in the air basically causes this infections. It's and this common cold is basically prevalent throughout the season, but there are some peaks which will happen, especially in this monsoon season. The peaks will happen. It's difficult to really get completely yourself immune or completely away from the disease, but the use of masks actually has brought down the incidence of common cold and flu, because masks for COVID have prevented. So basic sanitary methods like wearing masks, or especially in crowded places, keeping away from people who are sneezing or having cough and cold, would and regular hand washing. This will go in a long way to prevent a common cold. But generally, common cold is mild. It's influenza, which is many times a little worrying, especially people with weakened immune system, uncontrolled diabetes, patients with kidney problems, cancers. Influenza can cause serious complications. So basic precautions like wearing masks. Such people need to wear masks in a crowded room, or meeting some sick persons, going to hospital, or meeting someone with cough, cold, using sanitizers. That's a basic requirement that will prevent such infections.
The tendency now in many places is that when you get a cold, people just go and buy some antibiotics and they have it. So, could we talk a little bit about, like self-medication and how that's really not going to work in many of these conditions and it's not the right thing to do?
Yeah, Dr. Srinidhi, that's a very important point which you brought up. Over-the-counter use of antibiotics is the reason for global emergence of very resistant bacteria. Many of the antibiotics are being used, misused, overused, underused, all sorts of things. People take antibiotics for 1 day, 2 days, they get better. So most of this infection that we talk of, airborne flu, influenza, simple cold, runny nose, the mild sore throat, mild cough, are basically viruses. And just to tell you, viruses, no antibiotics work. No antibiotics will kill any virus, and and most of the times it's all viral infections which cause this. Using antibiotics are going to promote more resistance and actually weaken your immune system. This one thing which most people forget. They think antibiotics are good, but actually they weaken your immune system. Your body has a lot of good bacteria which keep on protecting you. We all are surrounded by millions and billions of bad bacteria. To fight those bad bacteria, our body is also colonized with billions of good bacteria. They keep our immune system healthy. So when you take an antibiotic, you not only kill the bad bacteria, you also kill many good bacteria, which are actually protecting us from our immune system from bad infections. So repeated use of antibiotics for simple cough, cold will lead to death of many of these good bacteria, which actually protect you from serious illnesses and serious infections. So strongly discouraged use of antibiotics for simple cough and cold. Over-the-counter use of antibiotics for a fever for 1 or 2 days is strongly discouraged. You need to talk to your doctor, be very sure it is a bacterial infection, take appropriate tests to prove there's a bacterial infection, and then start antibiotics, not over the counter starting medicines, just that I had a fever in the night. Let me start some antibiotic in the morning and I'll see the doctor after 2 days. That's a complete wrong approach. And just to tell you one thing, the word antibiotic means, if you break it up, it means anti means against and bio means life. So antibiotic basically is against life. So you're killing yourself in the long term if you keep on using antibiotics.
That's a very valuable point, Doctor. So now we'll talk about, are there any vaccines or are there any, like, I know that malaria travelers take prophylactic doses of certain medicines. So when are these kind of things recommended, and what kind of vaccines are available for many of these infections?
Malaria, yes, we do have dengue vaccines were introduced, but they did not find a good success. And there were a lot of bad reports, especially from Philippines and other countries. Bad reports came of dengue vaccine causing more severe illness. So the dengue vaccine, which was initially introduced, called Denguevarix, is no more not used much now. Our government of India does not promote use of dengue vaccines. But fortunately, we are in the phase 2 and phase 3 trials of a newly developing dengue vaccine. So from in our country, the research is on dengue vaccine development. Maybe soon we may see a dengue vaccine in the next few years. So we don't have any vaccine for dengue and no prophylaxis for dengue. You can't take any tablets to prevent dengue. For malaria, again, there's a vaccine exists, but again, it's not really promoted in our country as much. So more of what is required is for people who want to go to an area where malaria is predominant. In our country, most it's prevalent in most areas, but if you're going to, suppose, in a forested area where you think you may catch a malaria, so the treatments are with medicines. We call it chemoprophylaxis, in which we give some tablets, one tablet called doxycycline. Non-pregnant patients and children more than 8 years can take one day tablet of doxycycline every day, starting 2 days before going to the area and continuing up to 4 weeks after coming from there. That gives you adequate precautions, especially if people are going to areas where malaria is predominant. So there's other drug called mefloquine. If you can't take doxycycline, you can take mefloquine, which is weekly tablet. So there's a tablets available for malaria. There's a vaccine available, but it's not so much used. So more of malaria prevention is self precautions, mosquito nets, repellents, and if you're going to an area, we can use this drugs as a prophylaxis.
And for the foodborne infections, we do have vaccines for typhoid and
Yeah,
hepatitis.
typhoid vaccines and hepatitis A vaccines are available. Hepatitis B vaccines, the typhoid vaccine nowadays are being given to children as the primary immunization. So, and even if you've not got vaccinated in your childhood, you're free to take vaccine. Any adult is free to take vaccine at any age, provided you're not allergic to the vaccine. Only thing which prevents you from taking these vaccines is if you're allergic to any of the components of this vaccine. That you can discuss with your doctor, and it's safe to take hepatitis A vaccine, which will prevent you. Hepatitis A is a virus which basically transmitted through the water and it causes jaundice, and it sometimes can cause fatal jaundice. So hepatitis A vaccine does prevent you from getting the infection, and also the vaccine for typhoid. Yes, that's also should be taken, for, especially in our country when typhoid is quite prevalent. It's advisable to take the vaccines.
What about cholera, Doctor? Is there a vaccine for it?
Not much, no vaccines right now for cholera. There are medicines, but not vaccines for cholera.
So, generally, do you think that, like, is there, I mean, all these, we did say that it affects all age groups, but when these conditions generally happen in babies and infants, is it necessary that, like even at a very early stage, they need to be taken to the pediatrician, or they can also be, you were saying, like, I mean, we can monitor and we can check whether the fever is high or there are drivers for some of these infections, or do they need urgent medical care when they seem unwell during the monsoons?
Yeah, babies are a little different subgroup because their body surface area actually is higher, so they tend to lose or get dehydrated very faster compared to adults. So the babies have to the continued babies have continued to have fever, and obviously babies would not understand that they need to drink more. You can't expect a baby to understand that he needs to drink more. They will not drink water, or they not take food, so they will tend to get dehydrated. So babies will need to go to the hospital or to a doctor much earlier, much faster than the adult subgroup population. Yes, babies get dehydrated quickly, and especially with infections like cholera, babies
Yeah.
need to be treated separately. They have to be treated taken to the hospital or doctor quickly.
So finally, Doctor, I just wanted to request you to give some general health and well-being tips for people in the monsoons and how one can, stay fit and healthy.
Yeah, most of the things that we covered applies for monsoon. We already covered that. So
Yeah.
basically, you need to be careful about your surroundings. You need to see that you keep your area's surroundings clean, your community clean. See that mosquito breeding sites are minimized. And nowadays, a lot of pest control agencies are available, which you can take help of those to clean your communities. When you're going out, obviously take a sanitizer with you. Wash your hands frequently. When you're eating out, as I told you, try to see that you're eating well cooked food and food which is on the table warm. Avoid ice creams, especially if you're taking from the roadside vendors. Cut fruits from roadside vendors. Use some mosquito repellents. If you're going to a mosquito prone area, use mosquito nets at home. And and also, if you're in touch with or in nearby a coughing patient with coughing and cold, you should be wearing a mask and stay a little away from that person and use sanitizers appropriately whenever required. These basic precautions will prevent many of the infections that we get in the monsoons.
So thank you so much, Doctor, for your very valuable insights. And viewers, I do hope that you found this session informative. Do check out our social media channels, and you can reach out to us at any time. We're always available. You can walk into any of our hospitals in case you need further advice and treatment. So do enjoy the much awaited monsoons with a song in your heart and a smile in your lips, and not feeling fatigued and sick. Till we meet again, stay safe, stay healthy. Thank you and namaste.